Hey guys, so I want to go over everything from our Adult Health 1 PowerPoints for cardiovascular for our exam that is tomorrow. So go ahead and get out your PowerPoints, and I'm basically just going to read this stuff, say, hey, I think that's important, but that way we don't miss the little stuff that sometimes she throws in. Alright, so I'm going to start with the Assessment of Cardiovascular Functions, Chapter 25. Words that you need to know. This is going to be afterload, cardiac output, contractility, depolarization, ejection fraction, preload, pulse deficit, and repolarization. So I did a Quizlet that has all of that in it, so let me put all of that together. Okay, so we need to know afterload. This is going to be the amount of resistance to the ejection of blood from the ventricle. If we need to know it's the second determinant of stroke volume. Alright, so cardiac output, this is the total amount of blood ejected by one of the ventricles in liters per minute. Contractility is the ability of the cardiac muscle to shorten in response to an electrical stimulus. Depolarization is electrical activation of a cell caused by the influx of sodium into the cell while potassium exits the cell, going back to the first patho test. Ejection fraction is the percentage of blood ejected from the heart during systole or contraction. Preload is the degree of stretch of the ventricular cardiac muscle fibers at the end of diastole. Pulse deficit is the difference between the apical and radial pulse. Repolarization is just the simplified relaxation of the heart. Alright, and that is it for this chapter. And it goes over the anatomy of the heart on these, so I'm not going to go over that. I'm going to read pretty quickly through this because this is pretty much the review of basics. The anatomy of the heart is a hollow muscular organ located in the center of the thorax. The heart pumps blood to the tissues, supplying them with oxygen and other nutrients. And the heart is composed of three layers: the inner layer, or the endocardium, the middle layer, or the myocardium, and the exterior layer, or the epicardium. Alright, the heart chambers. The pumping action of the heart is accomplished by the rhythmic relaxation and contraction of the muscular walls of its two top chambers, or its atria, and the two bottom chambers, or the ventricles. During the relaxation phase called diastole, all four chambers relax simultaneously, which allows the ventricles to fill in preparation for contraction. Diastole is commonly referred to as the period of ventricular filling. Alright. Systole refers to the events in the heart during contraction of the atria and the ventricles. Unlike diastole, atrial and ventricular systole are not simultaneous events. Atrial systole occurs first just at the end of diastole, so just at the end of relaxation, followed by ventricular systole, so when the ventricles contract. This synchronization allows the ventricle to completely fill prior to ejection of blood from their chambers. Heart valves. The four valves in the heart permit blood to flow only in one direction. That's important. There's two types of valves. You have your atrioventricular valves, which separate the atria from the ventricles, and then you have your semilunar valves. These are composed of three leaflets, and these, you have two of them, the pulmonic valve and the aortic valve. The coronary arteries. You have left and right coronary arteries and their branches, which supply arterial blood to the heart. The myocardium, again, you have the middle muscular layer of the atria and the ventricular wall. Again, nice pictures. Alright, function of the heart. Cardiac electrophysiology. The cardiac conduction system generates and transmits electrical impulses that stimulate contraction of the myocardium. Both the sinoatrial, or the SA node, also known as the pacemaker, and the atrioventricular, or AV node, are composed of nodal cells. The SA node, again, is the primary pacemaker of the heart, and the AV node is the secondary pacemaker of the heart. And then you have the cardiac conduction system. Nice picture again. To reiterate, depolarization is the electrical activation of a cell caused by the influx of sodium into the cell while potassium exits the cell. And repolarization, like we said for simplicity, is relaxation. It's the return of the cell to the resting state caused by re-entry of potassium into the cell while sodium exits the cell. All right, cardiac hemodynamics, the cardiac cycle. The cardiac cycle is the sequence of events that occurs when the heart beats. As the heart beats, it circulates blood through the pulmonary and systemic units of the body. There are two phases of the cardiac cycle. In the diastole phase, the heart ventricles are relaxed and the heart fills with blood. In the systole phase, the ventricles contract and pump blood to the arteries. Nice picture again. Cardiac output, the total amount of blood ejected by one of the ventricles in liters per minute. She did say that there are no test questions on the cardiac output being able to calculate anything like that. Stroke volume is the amount of blood ejected from one of the ventricles per heartbeat. There's a nice little diagram there. The cardiac output responds to changes in the metabolic demands of the tissues associated with stress, physical exercise, and illness. Then we have the preload and afterload again. The preload, or the degree of stretch of the ventricular cardiac muscle fibers at the end of diastole, or the end of relaxation. And then we have afterload, which again is the amount of resistance to ejection of blood from the ventricle, and it is the second determinant of stroke volume. All right, preload and afterload, nice little diagram there. Health history, so patient's ability to recognize cardiac symptoms and to know what to do when they occur. Signs and symptoms of cardiac vascular disease. You could have dysrhythmias, palpitations, chest pain, shortness of breath, peripheral edema, unusual fatigue, and dizziness or syncope or fainting. And then, if you didn't know, palpitations just means skipping beats. All right. Past health, family, and social histories, including medications, nutrition, elimination, activity or exercise, sleep and rest, self-perception or self-concept, roles in relationships, sexuality and reproduction, and coping and stress tolerance. So pretty much everything. Physical assessment, checking their general appearance, assessing their skin and extremities, their blood pressure, pulse pressure, which is the difference between the systolic and the diastolic pressure, and then postural blood pressure changes or orthostatic. And then their arterial pulses, the rate and rhythm. Then we got landmarks, nice little picture there. The purpose of cardiac auscultation or listening is to determine heart rate and rhythm and to evaluate the heart sounds. All right, so moving on to heart sounds. We have our normal heart sounds. So our first heart sound is the tricuspid and mitral valve closure, which creates the S1 or the lub of the lub-dub. Then we have our second heart sound, which is closure of the pulmonic and aortic valves, which produces the second heart sound, or S2, which is the dub in lub-dub. Murmurs, these are abnormal, and they're created by a turbulent flow of blood in the heart. Interpreting heart sounds requires detailed knowledge of cardiac physiology and pathophysiology, and all nurses should at least have adequate knowledge. All right, diagnostic evaluation. You can have laboratory tests, the cardiac biomarker analysis, which includes ECG, creatine kinase or CK, CK isoenzymes or CKMB, and proteins such as myoglobin, troponin T, and troponin I. You can get a lipid profile, which includes cholesterol, triglycerides, and lipoproteins. Brion or B-type natriuretic peptides, which helps regulate blood pressure and fluid volume. This is something that you need to highlight for sure. This is on the test. She was talking about the BNP. I got nice new highlighters. Sorry, random. So definitely highlight that. Let me get, which color do I want? I'm feeling green. All right, so yeah, definitely make sure you've got the Brion B-type natriuretic peptides, helps to regulate BP and fluid volume, but that's the lab that you're going to see increased or elevated in order to determine, I think, heart failure or any kind of issue of the heart. Then you have your C-reactive protein, which is produced by the liver in response to systemic inflammation, and your homocysteine, or which is an amino acid. All right, assessment of other systems. You want to assess the lungs and the abdomen. You can get a chest x-ray to determine the size, contour, and position of the heart. You can get a fluoroscopy, which is an x-ray imaging technique that allows visualization of the heart on a screen. Electrocardiography, or an ECG, which is a representation of the electrical current of the heart. This is what you're going to see on like telemetry units. Cardiac stress test, which can be exercise and pharmacologic. This is a non-invasive way to evaluate the response of the cardiovascular system to stress. It can determine the presence of coronary artery disease, or CAD. It can determine the cause of chest pain, the functional capacity of the heart after a myocardial infarction or heart surgery, the effectiveness of anti-anginal or anti-chest pain, and antiarrhythmic medications. It can determine the occurrence of dysrhythmias and specific goals for a physical fitness program. So she did talk about ECGs. So I would know that an electrocardiography is a representation of the electrical current of the heart. And then she said to kind of know about different tests. So I think she also mentioned the cardiac stress test. It's a non-invasive way to evaluate the response of the cardiovascular system to stress. Going on, we have an echocardiography. It's a non-invasive ultrasound test that is used to measure the ejection fraction and examine the size, shape, and motion of cardiac structures. So again, I would know, be able to recognize it, but so let's see. An electrocardiography, or an ECG, is a representation of the electrical current. That makes sense. Cardiac stress, you want to see how the heart is responding to stress. Echocardiography, know that it's an ultrasound that measures ejection fraction and is useful for diagnosing pericardial effusions. Would be my way of recognizing it. She didn't really talk about the TEE that I remember, but the transesophageal echocardiography is good for evaluating the patient for heart failure, valvular heart disease, and dysrhythmias. Radionuclide imaging, which is the use of radioisotopes, so we should be able to recognize that, obviously. And it non-invasively evaluates coronary artery perfusion. I guess I would know that radionuclide imaging is non-invasive, and it evaluates coronary artery perfusion, also detecting myocardial ischemia and infarction. Computed tomography, or a CT, it's a form of cardiac imaging that uses x-rays to provide accurate anatomic images of the four chambers of the heart, valves, arteries, veins, and pericardium. So I would just know that a CT scan is like an x-ray scan, because that's how we can recognize it. A PET scan, or a positron emission tomography, is also non-invasive nuclear cardiovascular imaging technique, evaluates myocardial perfusion. So I guess knowing that it's nuclear, because I don't see that for anything else, also non-invasive, and evaluates myocardial perfusion. Easiest way to remember that. All right, so left page. Magnetic resonance angiography, or the MRA, I believe she did mention that. That it's non-invasive and painless, and it evaluates both the physiologic and the anatomic properties of the heart. And it's valuable in diagnosing diseases of the aorta, heart muscle, and pericardium. And then we have cardiac catheterization. This is invasive. So this is the only one that I've seen so far that is invasive. So I would know that. Cardiac catheterization is an invasive diagnostic procedure in which arterial and venous catheters are advanced into the right and left heart. So again, cardiac catheterization is the only invasive technique that this is showing so far. All right, hemodynamic monitoring. You have your central venous pressure monitoring, or CVP. It's a measurement of the pressure in the vena cava or right atrium. The pressure in the vena cava, right atrium, and right ventricle are equal at the end of systole. The CVP also reflects the filling pressure of the right ventricle or preload. Normal CVP is 2 to 6 mmHg. Pulmonary artery pressure. This is used in critical care for assessing left ventricular function, diagnosing the etiology or the cause of shock, in evaluating the patient's response to medical interventions. Intra-arterial BP monitoring is used to obtain direct and continuous BP measurement in critically ill patients who have severe hypertension or hypotension. It's useful when arterial blood gas measurements and blood samples need to be obtained frequently. Radial artery is the usual site for intra-arterial BP monitoring. I don't think she mentioned anything on that. So that is it for Chapter 25, Assessment of Cardiovascular Functions. So, yeah, I will go on to the next one in the next video.